Hi, welcome to your cat's spay discharge video. Along with this video, you'll also receive a set of written discharge instructions that you can take home and refer to. Please remember that every pet's recovery is going to be a little bit different, but we're here to help and answer any questions you may have to make sure the recovery is as smooth and stress-free as possible. Your cat has been given an injectable pain medication today called buprenorphine. This is a slow-acting medication. This means that it will be in your cat's system for the next 3 days, helping to keep her as comfortable as possible while she recovers. We're also going to send you home with an oral liquid called meloxicam. It's going to come in a single-dose syringe just like this. Meloxicam is given for pain and inflammation. You're going to start the first dose 24 hours after surgery and then repeat each dose every 24 hours until they're gone. To give the medication, you simply remove the cap from the syringe, place the syringe into your cat's mouth, and press the plunger. This medication has to be given with food, so please make sure your cat eats first before taking this medication. If you find giving it to her directly into the mouth is not possible for you, you can mix the medication with a small amount of really tasty food, as long as she eats all of it and gets her full dose. If you do find she has any vomiting or diarrhea after she takes this medication, please stop the medication and contact us. Now that your cat is spayed, weight gain is very normal, so we do ask you to monitor your cat's daily food intake. You can measure out the amount of food she's to eat every day. You may also need to adjust the type or the volume of food that she's eating. Once your cat is recovered, if she's still eating a kitten food, you can now transition her onto an adult cat food. But just be mindful that any change in diet needs to take place slowly over 5 to 7 days to avoid any gastrointestinal upset. Another important thing to note is that your cat was fasted for about 24 hours. That, paired with the drugs that we send home, all contribute to slowing down the GI tract. It's pretty normal for a cat to not have a bowel movement 1 to 2 days after surgery, but all bathroom activities should return to normal after that period of time. When you get home the evening of your surgery, please make sure you have somewhere nice and safe and quiet for your cat to recover. Disorientation is pretty normal after surgery. If you do live in a home that has other pets or children, it would be a good idea to have her recover somewhere quiet and separate from the busyness of the household. So a bathroom or a small bedroom. Please make sure that you include comfortable bedding, a litter box, her food, and her water. It would be a good idea to tuck her toys away for the next 14 days to allow her to recover. If we can, to the best of our ability, discourage running and jumping just to allow her incision site to heal, that would be ideal. Please avoid grooming or bathing during this time. Please check your cat's incision site daily, looking for any signs of irritation. That can include redness, swelling, or discharge. If you do notice anything concerning, please give us a call. The most important thing to remember is to not allow your cat access to lick or chew at her incision site. To prevent this, we're going to send you home with an e-collar, also known as an Elizabethan collar. This will be fitted to your cat in hospital. The Elizabethan collar needs to stay on for 14 days. You are allowed to take it off for brief periods of time while your cat is under direct supervision. Anytime your cat is not directly supervised, she needs to wear her cone. If a cone is not a reasonable option for your cat, there are also post-surgical bodysuits that work really well. You can purchase these from Amazon, other online stores or pet stores, or even from us as well. We also need you to keep the incision clean and dry for the next 14 days. If your cat does go outside, please keep them indoors. All of the sutures that we use are dissolvable, and they're all buried underneath the top layer of tissue. So there's nothing that we have to remove. They will all go away on their own. If you have any concerns about anything that you're seeing, our phone number and email address will be included at the top of your discharge instructions, as well as the contact number for the emergency after-hours care provider. Provided there are no new health issues that occur, you're welcome to purchase flea and tick prevention from us for the next 12 months. If you do need to schedule an annual wellness appointment or a vaccine appointment, you can contact us. Thank you very much for choosing our veterinary hospital.